First one is erectile dysfunction. Erectile dysfunction. And erectile dysfunction, guys, can present in different ways. I will give you guys some specific case scenarios, some like specific case scenarios, and we'll go quickly through them. The first case scenario, it could be someone who is young or middle age with some stress in his life, new relationship maybe, and he's coming with erectile dysfunction. He's thinking too much about his sexual performance. This is affecting his actually erection. In another way, it is psychogenic related. And we'll come how you can differentiate, because some specific questions you need to ask. Could be medication related. Some medications, guys, can cause erectile dysfunction. For example, SSRI, or some some hypertensive medications. For example, beta blocker can cause erectile dysfunction. Or it could be organic. It could be organic. Diabetes mellitus related, neuropathy, all of this. So let's assume, guys, you are having any of these case scenarios. Could be someone who is really old, maybe 70 years old, 60 years old. I had this case scenario many times. Someone who is really old, coming asking for Viagra. Coming asking for Viagra. So what are the questions? It's very important, guys. I highlighted for you in a red color what you should not miss. Definitely, guys, for how long? Is it getting worse, getting better, or the same? Did you have any good erection before or no? Don't forget to ask about morning erection. It's very important. Morning erection. Ask about any UTI symptoms, STI symptoms, any LUTS symptoms. LUTS symptoms, okay? Like any poor urine flow, terminal dribbling. Do you have the feeling that you didn't empty your bladder fully after you go for a wee? Diabetes mellitus, don't forget to ask about this. You can ask about any leg pain, any calf pain, especially if they are old people. If they are old people, don't forget to ask about other cardiovascular comorbidities. If you have time, you probably can ask about some hormonal imbalance. For example, pituitary, do you have any visual change? Okay. You can ask about hyper or hypothyroidism if you have time. But what you should not miss, for how long, getting worse or better or the same. Did you have any good erection before or no? What about the morning erection? Ask about UTI symptoms, STI symptoms, any low symptoms, diabetes, maybe chest pain or leg pain, or any change in sensation in the lower limb, especially, or back pain, especially if he is old people, 60, 70 years old. Ask about hobbies, because cycling, especially more than 3 hours a week, sometimes can affect as well. Okay, if you have time, you probably can ask about like gynecomastia, any testicular mass, all of this. Ask about mood and relationship stress, any sexual dysfunction issue, very important to ask about impact on relationship, very important to ask about impact on the mood, impact on his self-confidence. Okay, sexual history, yes, tell me more about your partner. Is he male or female? Are you happy with your relationship? Any stress in your relationship? All of this. Erectile dysfunction also can be caused by what? Can be caused by recreational drugs. Cannabis, weeds, cocaine, heroin, all of this. Ask about alcohol, smoking, because healthy lifestyle can improve also erection. Okay. If he's taking also gym medications like steroids at the gym, especially if he's young man. Don't forget definitely ice and impact. So how you can approach a different case scenarios? If it is psychogenic related erectile dysfunction, it sounds like the stress and the anxiety around your performance may be contributing to your issue or erectile dysfunction. Very common. Okay, the fact that you still have a morning erection is very reassuring and suggests that the physical mechanism for erections are working very well and intact. However, we will check for you everything to make sure there is no any underlying cause contributing to your erectile dysfunction. The good news is that we have many ways to help you, both medically and psychologically or mentally. If it is medication related, and when we say medication related, could be blood pressure tablet, could be SSRI. Okay, so it is if he stopped, and sometimes, guys, sometimes the patient come in the practice or in the exam telling you, doctor, since I stopped my blood pressure tablet, since I stopped my SSRI tablet, my erection has gone better. In that case, what you need to ask, how is your blood pressure now? Did you check your blood pressure? When was the last time did you take your medication? So ask about uncontrolled blood pressure if it was blood pressure tablet related or medication related for hypertension. If you stop SSRI, how's your mood now? Did you feel low since you stopped your medication? Okay. So it is true that some blood pressure medications, including the one you are taking, can sometimes cause sexual dysfunction, including the erectile dysfunction. However, stopping your medication completely will put you at risk of serious complications, for example, heart attack or stroke. It's very important to monitor your blood pressure very closely. Why? Because uncontrolled hypertension itself can damage the blood vessels over time, and it can worsen your erectile dysfunction. He cannot stop his blood pressure completely, blood pressure tablet completely. Why? Because uncontrolled blood pressure can worsen his erectile dysfunction in the long term. The good news is that we have alternative medications that can control your blood pressure and has a very minimal or less effect on your sexual function. Okay, so let's check your overall health. Let's work out together to find the best treatment for both your blood pressure and sexual health. And guys, my advice, I always say, try in your exam to mention about let's work out together, let's find out together. Okay, because at the end, you are required. At the end, you are required to make a shared management plan. How you can make a shared management plan? Engage the patient with you so you can make the plan together. If it is SSRI related, again, the same. Some medications, including those that you are taking, can affect your sexual function. Okay, but stopping them suddenly can cause a relapse in your mood symptoms. There are ways that we can manage this. For example, adjusting your dose, switching you to another antidepressant with a fewer side effect. Let's work out again together to find the best way to manage your erectile dysfunction and to manage your mental health at the same time. All right, this is just, guys, the different case scenarios for erectile dysfunction. Hopefully, if you will have one case in erectile dysfunction, it will not go outside of this. There's something called a questionnaire for erectile dysfunction. The questionnaire is called International Index of Erectile Function. International Index of Erectile Function. Or there's another questionnaire called SHIM. I forgot what is SHIM stand for, but it's a shorter version. In this station, when you will have a patient with erectile dysfunction, you can offer him, I will give you a questionnaire to assess how severe your symptoms are, so it will guide our treatment plan. Okay, it will guide our treatment plan. So you can offer your patient for erectile dysfunction, you can offer him this questionnaire. What is the management? Face-to-face examination. Try to bring your patient for face-to-face examination. And always give a rationale why I'm bringing you for face-to-face. Well, I will check your abdomen, feel your tummy, check your blood pressure, check your weight, check your height to calculate your BMI. We'll also can examine your genitals if you're happy with that, to make sure you don't have any signs and symptoms of testosterone deficiency, and to rule out if you got any lump in your testicles or not. If your patient is old, coming with loose symptoms, you can offer digital rectal examination. What are the investigations? Rule out diabetes. Lipid profile is also important, especially if your patient is old. Lipid profile. Fasting morning testosterone level between 9 to 11 a.m. Very important. It should be fasting morning level. If this level or if this hormone came back low, what you need to do, you need to replace that testosterone along with FSH, LH, sex hormone binding globulin, and prolactin. BSA, you might do it, especially if he is old, having loose symptoms. Thyroid function test, yes, we need to do it to make sure hypo or hyperthyroidism has been ruled out. Liver function test, renal function test to assess for any systemic issues as well. Okay, so there are a panel of investigations we need to run for this patient. Don't forget, guys, medication review is very important. If it is medication related, we need to switch his blood pressure tablet. If he was taking thiazide diuretics, spironolactone, bisoprolol, we need to switch. We can give him ACE inhibitor, we can give him amlodipine, we can give him doxazine. If it is sertraline or SSRI related, we can switch to mirtazapine. Then CKS insists on something to assess his cardiovascular risk for erectile dysfunction. You can't give everyone sildenafil. You cannot give anyone sildenafil. That's why, if you remember, I told you, especially if your patient is old patient, 60 plus, 70 plus, you need to make sure they don't have any heart failure symptoms, no chest pain, no any calf pain. Because if your patient is not at high risk of cardiac issues, like high cardiac risk, if he is not having any high cardiac risk, we can give him phosphodiesterase inhibitors. We can give him sildenafil. Okay. If you are offering sildenafil for anyone in the exam, don't forget asking about allergy, and don't forget safety net about periapis. If you got continuous erection for more than 4 hours, it is emergency. He needs to go to A&E. Side effect for sildenafil or Viagra can cause some headache, some dizziness, especially when you stand up, some flushing, because it can drop your blood pressure. Also, nasal congestion sometimes can happen. What is the cardiac risk stratifications? How you can explain a cardiac risk stratification to the patient? Because erection involves a good flow or a good blood flow, your heart health play a very important role in your erectile function. We will use a very simple system to check if your heart is strong enough for sexual activity. If you have any heart disease, high blood pressure, or any past heart problems, we will assess your risk, and we may suggest the precautions or treatment adjustment to keep you safe. Very important. This is just what CKS says. If someone is having erectile dysfunction, and are they fit enough to have sexual activity, and can you give them Viagra or not. Self-help measures, guys, all of you guys very perfect in self-help measures. Healthy weight, healthy diet, exercise, all of this. Stop smoking, alcohol, recreational drugs, all of that. Management, manage your stress management, all of this. Reduce your anxiety. If it is affecting his relationship counsel, CBT, good sleep, hygiene, all of this. Limit caffeine, all of that also can help. All right, CBT or relationship counseling, we mentioned about this. STI screen if it is applicable. For example, if it's gay man, recent new relationship, or any recent new relationship, he's worried about HIV, we probably can do STI screen for him. Leaflet from Urology Foundation. If you know, guys, a leaflet, try to give him leaflet. If you stuck, a leaflet from patientinfo.co.uk or leaflet from NHS. Follow up after investigations or after probably a few weeks to see if the treatment was effective, if you are offering sildenafil or not. Safety net, we mentioned about safety net, especially about priapism. If you are offering Viagra, or if it is not better, getting worse, any new symptoms, he needs to come back. This is basically, guys, what you need to know for erectile dysfunction case. The coming are just extra information for your side. If you would like to read, okay, it will give you extra information for your daily practice, and you'll be very well equipped for the exam. What are the medications can cause erectile dysfunction? Thiazide diuretics, yes. Beta blocker, spironolactone, amlodipine, enalapril, or lisinopril. Amlodipine is less likely, very less likely. SCA inhibitors is also less likely. So the hypertensive medications that are more likely to cause erectile dysfunction: thiazide, beta blocker, and aldosterone receptor antagonist like spironolactone. Then antidepressant, most of them are more likely the SSRI. Okay, a typical antidepressant like mirtazapine is less likely to cause erectile dysfunction. That's why if he was taking SSRI or SNRI or tricyclic antidepressant, stop them and switch to mirtazapine. Sildenafil, for your knowledge, sildenafil, there are two concentrations, or actually 3 concentrations. The only one available over the counter is Viagra. Sildenafil, the Viagra is available over the counter. Sildenafil, 50 milligram. 50 milligram is available over the counter. The 125, it needs prescription. Take 1 hour before sexual activity. Duration, it can last the effect of the medication or the Viagra 4 to 6 hours. Tadalafil or Cialis, it takes it at least 30 minutes. The effect of the Cialis can last up to 36 hours. Okay, it is not available over the counter. We need to prescribe it for him. You can read about tips for phosphodiesterase inhibitors, okay, if you have time. And this is from CKS. This is just a summary from CKS. When you should refer: emergency admission if priapism, if you give him the medication; urology, if there is any lifelong symptoms, young age, trauma, benign or testicular abnormality. But again, in the exam, don't try to refer someone with erectile dysfunction straight away. Least likely referral will be an option for erectile dysfunction in the exam. You need to treat by yourself. And to be honest, most of the exam cases designed to be managed in the primary care. We mentioned that before, guys, and even we mentioned before the session before the June exam that don't refer everyone or ask advice and guidance for the secondary care. Try to manage by your own. Otherwise, you will get inappropriate referral. So this is just erectile dysfunction quick summary from CKS. Feel free to read it. What we have discussed already mentioned here. All of this again, and you will find the risk stratification, cardiac risk stratification. Okay, is he safe to have sexual activity or no? If it is low risk, he can have sexual activity. Intermediate risk, require cardiology assessment before resuming sexual activity, or high risk, avoid sexual contact. And here, what does that mean by low risk, intermediate risk, and high risk? You will find if it is low risk, for example, controlled hypertension, someone having stable angina, someone had MI more than 6 weeks ago, had coronary revascularization. All of these people are classified as low risk. What does that mean? They can safely have sexual activity. What about high risk? Unstable angina, MI less than 2 weeks ago, severe heart failure, uncontrolled hypertension, high risk arrhythmia, hypertrophic obstructive cardiomyopathy. All of these people are at high risk. Don't advise them to have sexual activity. Advise them stop having any sexual activity. Refer them to cardiology to advise about when they can have sexual activity. That is what CTS says about cardiac risk stratification. Again, drug-induced, many drug-induced guys can cause erectile dysfunction, more than antihypertensive, more than antidepressant. Okay, it's worth knowing what medications can cause erectile dysfunction, just in case if the case scenario will be changed. Okay, surprisingly, ranitidine and cimetidine also can cause erectile dysfunction. Try to ask about over-the-counter medication. Okay, cytotoxic, most of them can cause erectile dysfunction. As you can see here, alcohol, heroin, cocaine, cannabis, all of this also anabolic steroid or gym drugs can cause erectile dysfunction. That's why it is very important to know what medications can cause erectile dysfunction, because sometimes you can find a patient who is taking, for example, spironolactone or thiazide diuretics or pregabalin or gabapentin or having anti-epileptic, all of this, okay? All of this, or taking over-the-counter ranitidine, all of this can cause erectile dysfunction.